Hello, I'm Josh Newman, Physician Assistant with Dr. Brett Taylor, a fellowship-trained, board-certified surgeon at Town & Country Crossing Orthopedics. With over 15 years of professional experience in workers' compensation and litigated spine care, Dr. Taylor understands the accuracy and scientific clarity required in these cases. He has created the Taylor Spine Team, which is composed of competent and considerate healthcare providers that are dedicated to providing top-tier spine care to injured individuals. Town & Country Crossing Orthopedics offers precision-based spine care, which focuses on the patient as an individual. Dr. Taylor evaluates patients from a variety of backgrounds and cultures. He works closely with patients, spending time thoroughly explaining their treatment options and always giving opportunities to ask questions. New patients will spend significant time with Dr. Taylor, Lori Burke, RN, Workers' Compensation Coordinator, and me. We focus on patient expectations and accountability. Prior to surgery, a timeline is signed by the patient outlining expectations, expected return to work, and maximal medical improvement. Through an evidence and precision-based medicine approach, our work speaks for itself. Thank you for watching. Dr. Taylor will be speaking next on a topic important to us at TCCO.
Hello, I'm Dr. Brett Taylor. I'm here to explain the diagnosis of failed back syndrome. Failed back syndrome is a nonspecific wastebasket term that simply implies that after spine surgery, the patient and the surgeon's expectations were not met. It is important when performing spine surgery that the surgeon convey realistic expectations to the patient. In the spine literature, an improvement of 50% is actually considered an extremely good result. To evaluate a patient with failed back syndrome, first the surgeon must determine what is the cause of the persistent symptoms. The different causes of failed back syndrome include foraminal stenosis, hardware malalignment, pseudoarthrosis, and adjacent segment disease, along with many more. It's important for the surgeon to distinguish intrinsic pain or neuropathic pain from persistent neural compression. A failed fusion or pseudoarthrosis can also cause pain after an attempted fusion, and this is diagnosed with dynamic radiographs or a CT scan. It's important to determine if the initial or primary surgery was appropriate for the patient's problem. When I evaluate a person with failed back syndrome, I first evaluate whether the technical goals of the first surgery were accomplished. I also rule out psychological factors such as depression, substance abuse, and pain behaviors prior to any revision surgery. To evaluate the psychological factors, a number of objective testing tools can be utilized to assess whether psychological factors will contribute to a poor surgical outcome. In general, the success rate of revision surgery is not as good as the success rate for primary surgeries. So revision surgery can only be successful if a clear diagnosis explains the patient's symptoms and if the diagnosis can be improved with a surgical intervention. Prior to performing any type of revision surgery for failed back syndrome, testing should be done to rule out an infection. This includes various laboratory studies. With the advent of disc replacement, there are now cases where individuals who've had disc replacements have failed surgery. Let us help you determine the cause and treatment for your post-surgical back pain.
Hi, I'm Alyssa Visconti, Administrator at Town & Country Crossing Orthopedics. In addition to orthopedic spine surgery, Dr. Taylor also offers supplementary services such as IMEs, chart reviews, and case evaluations. New patients as well as IMEs can expect to be seen within 10 business days of request and finalized notes completed within 5 business days. Every effort is made to maximize appointment efficiency. We also offer day of appointment work status reports and immediate accessibility to Dr. Taylor and his staff through numerous channels. At Town & Country Crossing Orthopedics, case managers are welcomed. We offer an inviting case manager lounge. To experience better spine care, contact Town & Country Crossing Orthopedics. Watch for our upcoming videos in this 12-part video series, and thank you for watching.